From a medical point of view, yes, I think that we should continue to be masking, particularly as we go through an uptick in what appears to be a new wave. We know that you wearing a mask will help to protect you. It will help to protect the people around you. We know it is not perfect, but it's one additional layer. It's one additional strategy that you can use. It's not a particularly painful or difficult strategy. And I think it makes sense to continue doing this. So from my point of view, certainly in our offices and in medical settings and congregate settings, we're really continuing to urge our patients to be wearing those masks in those settings where we know their risk is greater. There's a lot of COVID out there, and there's a good chance that if you're unmasked, you increase the risk of it finding you.
How long would you, and I know it's hard to predict, and this pandemic's been so unpredictable, but what would your advice if someone were to say to you, should I be wearing my mask for the next couple of weeks, next couple of months? What advice would you offer?
So the one thing we've learned over this entire pandemic is that we have to be flexible,
Yeah.
we have to be nimble, and we have to be responsive. So I think the answer to that is let's see how the data goes out over the next few weeks. Let's see what happens with this wave. We know that because of our vaccine strategy and boosting, this is likely to not be as painful as some of the other waves have, but we've already seen an increase in hospital admissions. So, let's work in real time. Let's respond in real time. And when we see the situation is improving, then we'll adjust the type of advice that we're giving. But as I always say to patients, I don't have a crystal ball. I know what's happening right now, and I think the strategy makes sense right now to continue masking.
And you mentioned vaccines as you were talking there, and we know that British Columbia will be giving an update later on today about a fourth dose. Your take there as we look at what fully vaccinated really should mean now in this country as we're dealing with now a sixth wave in this.
So I think we recognize that 2 doses forms the basis for vaccines, but that a boost does bring your immunity up because we do see waning immunity. So if you haven't been boosted and you're eligible for a booster, then definitely you should get that 3rd booster. The 4th booster, I think, does make sense in terms of those who are particularly vulnerable, those who are at the highest risk. And we know those are going to be indwelling in terms of long-term care, but also our elderly within the community. We're likely to see that evolve over time. And those of any age that are immune compromised that are at the age where we do recommend a booster, be it a 3rd or a 4th. So again, responding to the data of what we see. And we've seen some of the Israeli data that does show in particularly vulnerable people that 4th dose does make a difference. So again, that's a moving target, and we'll continue to see it evolve over time in terms of who is the best candidate to get that 2nd booster or a 4th dose.